More than 1 million or near about 1 million cases every year get added in India of diabetes. The very commonest cause of blurry vision or vision loss in India and in the world is some causes which is very common. We discuss today. I am Dr. Goel from Sanjeevan for Perfect Eyesight, Bombay. Today's topic is diabetic retinopathy. Diabetes is a very common cause which is giving a retinopathy or eye problem, or the diabetes itself is a common disease, very much common. You can find in each and every house one or two people are diabetic, or mostly alternate house. But that happens in all over the world, and in India, near about, as I said, 1 million cases are getting added every year. Diabetes, if it is uncontrolled or is poorly managed, can give rise to so many problems. So, long-standing diabetes can give rise to the complications. 1 in 15 cases of diabetic people, they can have diabetic retinopathy. What is diabetic retinopathy? Diabetic retinopathy, as the name suggests, due to diabetes, disease of the retina or complication of the diabetes in the retina is called as diabetic retinopathy. Where the retina gets involved. Retina is the backmost layer of the eye, which has the photosensitive cells, which are important part where we are seeing. So that get involved in diabetes. So long-standing diabetes, which is poorly controlled, or high blood sugar, can give rise to diabetic retinopathy. Diabetes either part type 1 or type 2 or diabetes in pregnancy can have diabetic retinopathy. The ladies or females who are diabetic and getting pregnant are very vulnerable, or any lady in pregnancy become diabetic also is very vulnerable, and they may have this diabetic retinopathy more than the normal cases. So this is the what is diabetic retinopathy. Now, what are the causes of diabetic retinopathy? As I said, uncontrolled diabetes, high sugar level, which is not under control, can give rise to diabetes. Or diabetic people who are not very active, their lifestyle is sedentary, they have chances of diabetic retinopathy. Diabetic people who has abnormal cholesterol due to lifestyle or anything, their diet, they are abnormal cholesterol. If they have the bad cholesterol is more, they can go to diabetes, diabetic retinopathy. Blood pressure. If the diabetic person having a blood pressure, both the things, diabetes or blood sugar level and the blood pressure are not under control, can give rise to diabetic retinopathy. Sometimes diabetes, it looks under control, but so much stress in the life, blood pressure is there behind, cholesterol is also very high, activity is also not too much in the life, that all can lead to diabetic retinopathy. What are the types of diabetic retinopathy? There are generally two types, non-proliferative and proliferative. And before we go to the types, what happens in diabetic retinopathy? The blood supply of the retina. Retina, I said, the photosensitive cells, the backmost layer of the eye is called as retina. The blood supply, the fine blood vessels which is supplying blood to the retina, they get blocked due to high level of sugar. When they get blocked, the nutrition to going to the retina get blocked. These new blood vessels which are formed by the retina and the eye, they are fragile. They can break anytime. Once they break, the fluid comes in the eyes, either beneath the retina or in the vitreous. Vitreous is a jelly-like substance which is filled in the eye. that happens in diabetic retinopathy. It can be non-proliferative, it can be proliferative. Non-proliferative, when the new blood vessels get formed, but they are not bleeding. They form the nodule-like structure on their walls, but they are not bleeding. So, on the eye examination, we can see white spots on the retina. They can cause the vision blurriness and all, but they are not bleeding. They may not have any symptom also. Sometimes they may not have any symptom, but during the eye examination, we find out white spots on the retina, means the non-proliferative diabetic retinopathy is there behind. In the proliferative retinopathy, diabetic proliferative retinopathy, in that the blood vessels which are newly formed, they start breaking. They bleed inside. They causes the exudates coming outside, the fluid coming outside. So that bleeding can be underneath the retina or in the vitreous area, that we can vitreous hemorrhage. When the blood gets collected or blood comes out in the vitreous or beneath the retina, they give vision problems. As in the center, the blood gets collected in the retina, they give edema, diabetic macular edema, swelling over the red macular center part. So, blurriness of the vision can be possible. So, what are the symptoms of diabetic retinopathy? How we come to know the diabetic retinopathy can be there? Blurriness of the vision, fluctuating vision, floaters, areas of the darkness or threads like there in the vision, dark areas and emptiness on the areas in the vision, and the vision loss can be also there. They may be the symptom of the diabetic retinopathy. How to diagnose diabetic retinopathy? Eye examination. When we have eye examination, when we dilate the pupil, put a drop and dilate the pupil and see inside, we can see the structure of the eye from inside, where you can find out diabetic retinopathy is happening. Second is fluorescence angiography. We inject the dye in the arm, and when the dye reaches to the blood circulation or the blood vessels of the retina, where we can see the vessels are either blocked, or they are bleeding, or they are fragile, or the bleeding is over there, or they are breaking, we can see through the dye in the fluorescence angiography. Then OCT, very common diagnosis tool, where we see the structure of the retina. Sometimes we see that too much of fluid get collected beneath the retina that form the swelling in the center, called as diabetic macular edema or cystoid macular edema, like a cyst of the fluid that comes in the center, causes a lot of blurriness. So they were the symptoms were there, I said. Now, how to diagnose, I said. Now, what is the treatment of diabetic retinopathy? In allopathic way, the treatment of retinopathy is giving injections, anti-growth factors, but they require giving off and on injections in the vitreous. The injection has some complication like infection, building a block, but it's not a permanent treatment. They have to keep on giving injections whenever is required, because diabetes is a lifelong process. It's not cured. It's a chronic process. Second treatment, we advise they have to take care of the pressure of the eye, blood pressure of this body, taking care of the level of blood sugars, taking care of the eye health if they have any other complex problems. But here in Sanjeevan for Perfect Eyesight, we treat diabetic retinopathy very well by improving the circulation of the retina, trying to stopping the breakage of the new blood vessels, Whatever the bleed is there inside, it should go back, because the bleed is not from outside of the body, it is from inside of the body. So it should go back in the body so the edema can be taken care. I have seen so many cases of macular edema which can reduce, which got reduced without the injections. And then you can maintain your good retinal health and good eye health. So here in Sanjeevan for Perfect Eyesight, with integrated methods, we can treat diabetic retinopathy very well. If somebody follows the system, they can improve their vision, they can stop the deterioration of vision, they can prevent or they can stop the bleeding of the new blood vessels, and they can take care of their eye health, and they can maintain their good vision without injection, without operation, without laser, without LASIK, without steroid, without antibiotics, and without any complications also. Very safe procedures. Now, when we go and see what are the complications of diabetic retinopathy, we don't treat it in time. When the blood vessels get blocked in the eye retina, they can give an effect to the drainage of the system also in the eye. Fluid drainage is get stopped. The nerve cells get damaged of the optic nerve, the nerve which is passing message from eye to brain. So we can see the cupping of the disc where the nerve get attached. So and they can increase the blood, they can increase the pressure of the eye, that can cause the glaucoma. So side effect of diabetic retinopathy is glaucoma. As we know, vitreous hemorrhage is another complication. There is a lot of blood in the jelly-like substance, which is jelly, which is filled in the eyes. They give lot of complications and lot of symptoms. Wherever the blood comes in between, we will find the problem in the vision. Sometimes that get fluctuated from here to there. Floaters can be seen, blurry vision can be seen. That is the complication. The more dreaded complication is when the bleeding starts beneath the retina or in the eye, they form the scars. When the scars, they pull the retina, they causes retinal detachment. Once the retinal detachment means the retina leave the place and get detached, then it causes the blindness. So blurriness can lead to the blindness. So it's a very important issue. Now, what is the prevention of this disease? Prevention is better than cure is a common saying. Prevention of diabetic retinopathy, the person who is diabetic, they should be very precautious, have regular eye checkup can be possible. If they face any problem like blurriness of vision or floaters or empty or dark spaces in the field of vision, or they get fluctuating vision, they should contact for eye checkup. If they are having a blood sugar, they should control the blood sugar in the limit. It should not remain the high level. They should control the blood pressure. If they are having a blood pressure should be controlled. They should control their cholesterol also by having a good lifestyle, good nutritious food, good healthy food. So they should not disturb their cholesterol. If the cholesterol goes high or the bad cholesterol goes high, they lead to this problem. They help in getting diabetic retinopathy. So the lifestyle is very important. Moderate exercises and the active lifestyle is very important. Like morning walks, some doing exercises. Then if they are alcoholic, they should control their alcohol, because alcohol is also one of the cause of creating complications in diabetic cases. Either diabetic retinopathy and other problems also. Smoking. Smoking also is one of the precipitating factor for diabetic retinopathy. If they are a smoker and having a diabetes, they should take care of the smoking. Having a normal, active, healthy life can prevent this disease from the diabetic person. The treatment of this problem can be possible in Sanjeevan for perfect eyesight without operation, without injection, without laser, without LASIK, without antibiotics, without corticosteroids. And if we can live a normal, healthy, active life, we can prevent this disease. Otherwise, the consequence of the disease can be blindness also. See you in the next video. Thank you.
Sanjeevan Eye Care for perfect eyesight.